Next, improving the breakdown of digestion. Again, if we're not breaking foods down, improving the breakdown and digestion of foods. So if we're not breaking foods down all the way, the larger the food molecules there are, the greater chance the immune system is going to see these things, tag them, and create some kind of an immune response. And so it's nice to be able to get these foods broken down to smaller pieces. Even healthy foods, right? Beef, chicken, if we don't break them down fully, we're going to have an increased chance of allergenicity. And the immune system was more likely to tag these foods, and you're going to have an immune response, and you may get brain foggy or sleepy or tired or more bloated or more gassy because now your immune system is actually creating a response, a reaction that's negative. So out of the gates, if you love it, rotate it. So if you're a beef guy and you're eating beef and steaks every day, you got to rotate it. If you love it, rotate it. Super important. That keeps your immune system seeing different foods, so you're less likely to react because you have different foods coming in every day. Also, we're chewing our foods really well. Good old adage is 32 chews, 1 chew per every tooth in your mouth. Now, you don't really have to count that many times. Usually chewing to like an oatmeal-like consistency is a pretty good rule of thumb. So feel what oatmeal feels like in your mouth. Your food should feel somewhat like that in your mouth. Chewing your food up very well. You can kind of count it at first, see how long that, maybe that's a minute of chewing, 1 chew per every second or two, right? Chew, 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 probably about a minute of so chewing per bite. That may be a good thing. That may be a good idea to kind of like gauge it, or just gauge it based on the texture. How does it feel? Does it feel kind of like an oatmeal-like consistency? Those are a couple ways that I do it. Next is not hydrating with our foods, right? Because water, it's got a pH of 7. So when we look at that bile and all of those digestive juices, that should have a pH of around 2 to 3. Well, we throw a whole bunch of pH of 7 in there. What happens to the overall pH? It starts to go up. And we need to activate those enzymes. Those enzymes are pH sensitive. So we bring those enzymes nice and low. We activate the enzymes by bringing the pH down. So more acid means low pH. Low pH means more enzyme activity. And that includes lipolytic enzymes, which are fat digestive, proteolytic enzymes, which are protein-based, or carbohydrate or amyloidic enzymes to break down carbohydrate. So we have to make sure we have good digestive juices. So we do that by 1, not hydrating with food and adding a bunch of alkaline or neutral pH. 2, we chew our food up really well, which increases the surface area. It allows the enzymes and the acids to actually work and break these foods down. You know this, like if you ever, just trying to think of an analogy. If you ever took a whole bunch of like towels and you threw them in the laundry and you packed it tight, and then you did the laundry, it didn't have enough room for the towels to open up and have the detergent and the water hit it. And so then you pull it out, didn't really clean it, right? Because it was packed so tight. But if you opened that laundry out by making more room in the washing machine, now everything hits it, now it gets clean. So it's kind of like the same thing. If we can open up that food, increase the surface area, those enzymes and acids have a much better chance of hitting it and breaking down. So that's really, really excellent way to think about it.